For individuals receiving anticoagulation therapy, the risk of life-threatening bleeding is increased after injury or trauma. In these situations, limiting excessive bleeding requires prompt anticoagulation reversal. Despite substantial evidence that prothrombin complex concentrate, PCC, reverses anticoagulant effects, the efficacy and dose-dependent effects of PCC are unclear, and optimal management remains undetermined. The present study investigated the ability of several PCC-based interventions to limit the effects of an anticoagulation agent under conditions of trauma-induced bleeding. In 48 pigs, which closely resemble human cardiovascular physiology and hemostatic processes, blunt liver injury and femur fractures were induced, concurrent with administration of the anticoagulant Rivaroxaban, a factor Xa blocker. Treatments included a control group, low, intermediate, and high doses of PCC, PCC low dose plus tranexamic acid, and PCC low dose plus tranexamic acid and fibrinogen concentrate. PCC at intermediate and high doses effectively controlled bleeding, restored homeostasis, and improved thrombin generation compared to control in low-dose PCC, but the highest dose PCC of 50 units per kilogram provided little to no additional benefit in reducing blood loss. Low-dose PCC, alone or with tranexamic acid only, was ineffective at controlling bleeding. However, low-dose PCC combined with the administration of tranexamic acid and fibrinogen concentrate nearly halved total blood loss relative to control and resulted in a 0% mortality rate. This suggests that PCC can be effective for bleeding control as part of a multimodal approach, rather than monotherapy.